Good morning, everyone. Happy holidays. Welcome to City Hall. Uh, Today, we have a wonderful announcement, but let me put it in some context for you. And quite candidly, it's a little personal for me for a couple of reasons. One, I don't know if Bernard Tyson knows this, but I like the number 5. I was born on the 5th day, the 5th month, in the 52nd year. So something along those lines is going to be good. Today, I'm happy to welcome Bernard Tyson, who's the Chairman and Chief Executive Officer for Kaiser Permanente, to make this announcement. The second reason I wanted to kind of put this in context is that a few weeks ago, the Hospital Council in San Francisco had released a report, and a report that confirms what I think we've been seeing for quite some time, and that is the healthcare industry in San Francisco is the #1 employment and economic impact industry in all of our industrial settings. Over $23 billion impact in our local economy, and certainly a great employer of thousands of people, many of whom, if not all, are right standing beside me and around me. I want to welcome our Director of Public Health, Barbara Garcia, certainly our Supervisor, London Breed, as well as our Director of our San Francisco Foundation, Fred Blackwell, here as well. So the healthcare industry, a big driver of our economy, lots of jobs, but ultimately it's also, and of course I want to welcome in our Supervisor, Malia Cohen, who I just saw. So she's coming in as well. Come on up, Supervisor. In addition to jobs, I know there's a great reason why there is at least 5 major hospitals under construction today in San Francisco. We care about health, not just the hospitals, not just when people walk in for treatment. Health has always been, as Barbara has taught us, as Bernard is teaching us and others, it's about what we do every single day to keep ourselves healthy. It is also about, as you will constantly hear from people like Supervisor London Breed and Supervisor Malia Cohen and certainly Fred Blackwell, health is about healthy communities as well. And this is as important as building hospitals. It's about building communities in a healthy way. It's about our youth. It's about families. It's about the things that we do to keep families intact. That's all part of this health discussion that we have. It's also about programs that Fred and I have worked on, and Tamika Moss, and now Colin Lake, and it's about Hope SF, about giving people who are in the worst, probably, housing settings, probably not taking care of themselves as well as they should, and providing them with a basis of hope. So this is the context in which I wanted to present one of my highest priorities, and that is making sure people have access to health insurance, to quality health care, but also to the very basic commitment to themselves and to their families that they should take care of themselves at the earliest stages. And for me, as a lifetime member of Kaiser Health, I love the fact that everybody knows about the whole theme of thriving, and I've had to even teach myself how to thrive, to be quite candid with you, because in my youth it was all about I ain't sick, and when I am, Kaiser will take care of me when I walk in to their facilities. Nowadays, it's about before you ever walk in, how can you take care of yourself? This is what we're trying to teach our workforce, to be quite candid with you. Is I have a 29,000 person workforce. Are they all in shape? No way. And we're all trying to thrive even better. And so this announcement today is significant for those reasons. It is about our most challenged population in the city. It's about a health institution that cares more than just when people walk into their institutions, their clinics, It's about how they can be even more healthier on their own and thrive on their own. It's about the programs that we run on an everyday basis where we do have the crisis interventions that we have, but we know that we wouldn't have to be in those crisis interventions as much as we are if people took care of themselves and had this opportunity to do so. Well, all of the programs that we've been really caring about, whether it's Hope SF, whether it's our numerous programs targeted at our public housing residents, whether it's the kinds of things that we're doing to access health care, are all part of this announcement today. I'm pleased to announce a significant donation from Kaiser to help us achieve our health care goals as an entire city. Today, Kaiser is donating $5.5 million to invest in our families and health in San Francisco. That's a significant number. As I told you, 5 is a good number. It's a great number. And I want to break it down a little bit for you as to how this particular donation, because I understand in the future there'll be other donations that Kaiser would be part of, and they're a great, obviously a great company, a great corporation, but they're also into healthcare for the long term, for more than just the hospitals, more than just the immediate treatment. Hope SF is something that I've been working on since way before my mayorship. It's something that Fred Blackwell worked on well before his ascension to the director of the San Francisco Foundation. And now we're bringing a lot more people on. Tamika Moss now is the director of that program. And Colin Lakin is helping her find all the sources that we could amass together to help what we think is going to be and necessary to be at least a $300 million capital program to rebuild our most distressed public housing in the city, but in the right way. It's never been only about the brick and mortar. It's about the people first. And this is why this donation is so important, because it allows us to invest in the people first. And this is what the Hope SF program was all about, a $25 million commitment to invest in people first. The incorporation and the collaboration with labor, with business leaders, with the healthcare organizations, with foundations, with nonprofits, with people on the ground focused on the people first. And so of this $5.5 million, $3 million of it will go to improve directly the mental health services at our 4 Hope SF sites in the southeast sector. And these efforts will have an immediate contribution to reducing violence, to creating resiliency, to obviously the community safety in their neighborhoods, but clearly for the residents there, their social and emotional health and their family resiliency. Another part of that $5.5 million is $1 million to the San Francisco Public Health Foundation to continue their support for a program called HEAL, the HEAL Zones, healthy eating, active living. And I know this is something that our supervisors are very excited about, because they've always been focused on healthy communities, healthy zones. And this particular program allows foundations to teach people how to eat healthier, how to live healthier lives, how to have access to the lifestyles that we want everybody to enjoy. Healthy exercise, which is why we invest so much in our parks and our recreation programs in the city. Get people's lives active. This is what that program will do. $400,000 will go directly to our general hospital for heart attack and stroke prevention. $250,000 will go to the San Francisco Clinic Community Consortium to support our community-based clinics. $500,000, $500,000 will go to Health Right 360 that will continue to help our insured and those that are facing homelessness or poverty to get access to health. This is an incredible part of our program for our homeless connection activities. $100,000 will go to the Center for Youth Wellness in the Bayview Hunters Point, again focused on delivering primary care for children that are living there. And another $250,000 will go to the University of California at San Francisco Center for excellence in primary care to improve healthcare delivery. You know, Kaiser is not just about themselves. This is what I love about my HMO too, and other HMOs. I mean, they're willing to invest in other hospitals that are doing good work to complement the work that they're doing. This is why I'm so proud of that, of what Kaiser is doing. And, you know, it complements the theme that I've been trying to get, that we are a very successful city economically. And more, you're going to see companies like Kaiser step up. We did that just last week right here with Google when they said they're stepping up on homelessness, on Wi-Fi to the parks, on helping our youth and families get around the city with theirs. You saw us here and other parts of the city when I partnered up with Mark Benioff and Lynn Benioff and the Salesforce Foundation and tackling the challenges of our middle grades and helping those schools succeed for our families. You'll find time and time again that we're going to be looking for the latest and greatest of our corporate leaders to step up and do what I know their values tell them that they would be doing. And so it is with great pleasure that I welcome to this podium a wonderful CEO, a chairman of Kaiser Permanente, someone who I've been getting to know better and better. But we begin with a discussion of simply what we believe in and what we want to do, and that's invest in our people. Let me present to you and thank Bernard Tyson, the CEO and chairman of Kaiser Permanente.
Thank you. Good morning, and thank you, Mayor Lee. It's always a privilege to be in your presence, and it's also such a wonderful thing to have such a dynamic mayor who is also a member of Kaiser Permanente. So I'm glad that we are living up to your expectations, and I might want to take you on the road with me to talk about Kaiser Permanente. It's an honor to be here on this morning to share what we have decided to do at Kaiser Permanente. I have to tell you, it's an honor to serve as the chairman and CEO of such a wonderful organization who exists for the purpose of doing good, taking care of almost 10 million Americans now around the country. We are a large mega health system, about $55 billion in revenue. We have almost 200,000 employees, and we have over 19,000 physicians who commit themselves every single day to Kaiser Permanente. I'm often asked, if you are a not-for-profit organization, what's the point of making a profit? And I generally have to explain to them that, like any other business, one of the reasons we have to make a profit is to demonstrate the viability of that business of healthcare. Secondly, we have to pay our bills just like any other business. Thirdly, we have to acquire capital to build hospitals and medical office buildings and technology. We have retirement plans, we have pension plans, we have all the makings that you will find in any big company, whether it's for-profit or not-for-profit in this country and, in fact, in this world. The big difference, though, is that what I don't do is have to pay dividends to shareholders. Because as a not-for-profit company, we do not have investors, shareholders, who reap profits from being a part of Kaiser Permanente. Our investors, our shareholders, are the communities, the American public, and the government, because we have been exempted from paying taxes. And so in some ways, our direct accountability is in every community in which we exist around the country, as well as to local, state, and federal governments. And so it's an honor today that I can stand here and share with you how we are paying some of our shareholders, which is the community of San Francisco that we love dearly as part of the family of Kaiser Permanente. we're honored to take care of almost 200, if not around 200,000 San Franciscans here. It's a personal honor for me. I started almost 31 years ago now at Kaiser Permanente in San Francisco. And every time I go to San Francisco, I let San Francisco know they are absolutely the best place for me to be at. And then when I go to Oakland, they are absolutely the best place for me to be at, in Washington, D.C., and on and on. So San Francisco has always been a special place for me personally, and obviously for Kaiser Permanente. The mayor and I met several times over the last couple of years, and in particular over the last year. And what I really admire about the mayor is he shared first his expectation that Kaiser Permanente, who is privileged to take care of many of the city and county employees here, he made sure that he delivered a strong message to me that I want you to continue to make this health care affordable and accessible to everyone in this city. And we have and continue to take that very seriously. And then secondly, he shared his big picture of how to make everyone in this city a part of the American dream. And unfortunately, because of the economic status around the Bay Area and the country, there are those who may not have it at this time to enjoy all the realities that we see in this country. And he shared some ideas about how can we work together and all step up and figure out how we make life better for everyone. And so the organizations that we picked and the organizations that we will pick going forward matches both his dream and our mission of being a part of organizations that are working every single day trying to make life better for others, and as we call it in Kaiser Permanente, to do good. And so it is an honor and a privilege for us to make the donation today for $5.5 million to the organizations that the mayor has highlighted. I assure you, we will be doing more. We do more all the time at Kaiser Permanente. One of the best kept secrets is that we actually give out over $2 billion a year in community benefit related programs around the country. That includes directly caring for people who do not have direct coverage, as well as we view ourselves as a big part of the whole ecosystem of the healthcare industry. And so it is natural for us to donate to other healthcare organizations because we all are working together to make healthcare better for everyone in this country. So I stand here honored to serve as the chairman and CEO of Kaiser Permanente, who cares about millions of people and care for millions of people every single day. So thank you for having us here today, and once again, it is just an honor to be a part of this. And now I would like to introduce Fred Blackwell, CEO of the San Francisco Foundation. Thank you very much.
You know, I whispered to Bernard back there that I think that he has a new spokesman for Kaiser Permanente. I expect to see Mayor Lee in the next Thrive commercial, probably. The mayor and Bernard have put it very well, so I'm going to be brief. I did want to just say a couple of things, though. One is I wanted to congratulate and thank the mayor and the Board of Supervisors for both establishing the vision for Hope SF and for the commitment to rebuilding this public housing in the right way. In the face of dwindling federal resources for public housing revitalization, the city stepped up and said that not only would they kind of step up to the plate to make this happen, but they would do it in a way that really made sense and made sure that the kids, the individuals, the families that really were victims of years of disinvestment and neglect were the same people that would benefit from this new investment. And so I just wanted to say thank you and congratulations, and thank you for allowing us to be a partner in that work. Really what it is about is not only the revitalization of the public housing, but doing it in a way that really minimizes or eliminates displacement, but also really spends the same amount of time, energy, and resources on investment in the people, as the mayor said, as we spend on investment in the place, which is actually very important as well. And so it's a big vision. And a vision like that does not get implemented, and it certainly doesn't get implemented effectively without partnership. And so the notion of being in partnership with the city and being in partnership with institutions like Kaiser is very important in this work. And we also just want to say thank you to Kaiser Permanente for the generosity, the thoughtfulness, and the commitment to Hope SF. The only other thing I wanted to say, the two other things. One is the partnership that we have with the city is not one that we are engaged in by ourselves. There have been a number of visionary and committed institutions that have also been with us in philanthropy. One of those is through Rich Gross and Enterprise, who is here today. There's also the High Senior Fund, the Bank of America, Wells Fargo, JP Morgan Chase, and a slew of other private institutions and philanthropic institutions that have been supporters. And we are very excited to welcome Kaiser to that group of folks at this level, which is probably one of the highest levels that we have received to help to implement this vision. So we are very proud to be in partnership with Kaiser. The second thing is this also would not be possible without the commitment and the passion of the residents of these developments. As the mayor said, this is something that I worked on well before coming to the San Francisco Foundation and well before working in the city of Oakland. And the early phases of this were meetings with residents who were highly skeptical of whether or not this would actually happen. And so their commitment to staying at the table, to giving us a fresh slate and to work with us and roll up the sleeves and be patient, but also hold our feet to the fire is something that I also want to express appreciation for. What I want to do now is bring up Supervisor London Breed. But before I do, I just want to say, you know, when we were working on this early on in the Newsom administration, I was the director of the redevelopment agency. And we were planning this stuff out and trying to figure out how it was going to happen. And then Commissioner London Breed was really one of the most committed commissioners on the Redevelopment Commission to this work at that time. She was somebody who was not a stranger to growing up and being around public housing, and so she knew not only what the opportunity was, but what the challenges were. And so London, Supervisor Breed, has been with us in this struggle the whole way, and it's a pleasure to be able to introduce her.
Thank you. Thank you, everybody. I'm so happy to see you all here. Another amazing gift to the city and especially to our residents of public housing. When I first became a member of the Board of Supervisors, the mayor asked me what are my 3 priorities, and I said public housing, public housing, public housing. And he said, okay, what is your other priority? Public housing. I not only was born and raised in public housing, I grew up there and I lived there during my college years as well, and I watched as I lost friends to gun violence, as crack destroyed our community, as people who I grew up with felt that what you did was some of the things that were happening in our environment. I thought that was normal. Violence was normal. And I felt isolated as a member of that community. And when I went to college, I saw something different and didn't understand why the same opportunities that were made available to me when I was on the college campus of UC Davis were not made available to members of my community. And that's when I decided that it was important that I make sure that I'm actively engaged in making sure that those opportunities are brought to the table for the folks who live in public housing. The sad reality is that even today, there is still a lot of isolation in public housing. The city, for the first time ever, under the leadership of Mayor Ed Lee, has contributed money to not only rehabilitate all of the broken elevators in public housing, but also over 170 units of public housing developments that were not currently occupied, and we have already moved over 42 families into those developments. And this is something the city has never done, given the support that public housing residents deserve. And that's why I'm so excited about today. Not only was the mayor born or has spent his whole life at Kaiser, I was born at Kaiser up the street. And I'm really proud because when a lot of folks from my community needed job opportunities, they were hired at Kaiser Permanente. And Kaiser is looking around and saying, you know what, we want to do more. We see the challenges of the residents of public housing, and we want to step up to the plate to make sure that health and wellness services are directly available to the residents, that social services that are missing in public housing are directly there when the residents need them the most. I was at Plaza East the other day with residents and the police talking about some of the challenges and the violence and the hopelessness. And what was so interesting is when I was growing up as a kid, we never talked to the police. We never had a relationship with the police. And here we have, in this day and age, a community talking to the police about what we can do to improve community policing, what we can do together as a community to work together to improve the quality of life of everyone who lives in public housing. It was really amazing, and it made me want to fight even harder to make sure that I do everything within my power as a member of the Board of Supervisors to bring the resources directly to the residents who need it the most. This gift is tremendous, and it is needed, and it is appreciated, and we are going to make sure that each and every dollar is used towards the purpose intended, and that is to change the lives of the residents of public housing. This is a start, and I'm looking forward to many more contributions in the future. Thank you.
Well, you'll not find more passionate or committed supervisors than Supervisor Breed and Supervisor Cohen. I want to just say thank you again to their collaboration with me. You know, we're at the end of 2014, but what we got is hope, we got our health, and we're going to all thrive together. Thank you very much for coming together. Thank you.